When does low back pain become a concern? When should low back pain become a concern? I guess should be the question rephrased back to the person that asked me. I've never had this question asked to me before. Actually, I guess because, as they say, beauty is in the eye of the beholder, well, so is pain levels too. I know some people that are so freaking strong and have such good pain tolerance, and I've seen them take things, surgery without anesthesia, teeth pulled without anesthesia, all these crazy things. Other people, you touch them and they start crying or they're in a ball of pain. That said, everyone's pain tolerance is going to be unique. It just depends. So, for those that don't know, my name is Brian Carroll. I live in Jacksonville, Florida. I'm a McGill Method certified provider, having powerlifted for over 21 years and ending on a high note of being the first person to squat over 1,300 pounds. I now work with people all over the world from both a virtual standpoint and in person here in Jacksonville, Florida, with injury, resilience, and performance enhancement. I'm not giving you medical advice. For more information, go to powerstrength.com. Thank you so much. Enjoy this video. First of all, we got to talk about low back pain. We have to define what low back is. Low back is 5 lumbar vertebrae and 5 sacral vertebrae. 5 lumbar vertebrae. Define low back pain. It could be a ligament, could be vertebra, vertebral bone or end plate. It could be a facet. It could be a pars. It could be part of the vertebral body. It could be a nerve tract, a descending nerve root, an exiting nerve root. See what I mean now? When people say low back pain, Dr. McGill talks about in the Huberman podcast, you got to define what low back pain is. What's low back pain? 80% of all back pain is non-specific. It can't be defined. Well, when you have idiots that are trying to define something they don't understand and can't do an assessment, you're going to have 80% of all back pain doesn't have a cause. It just magically happens. People just manifest it. Well, you haven't had a good clinician to give you an assessment and look at your MRI and put you through movements, postures, loads, and exercises that cause your pain, exacerbate your pain, and then remove your pain with special techniques and hacks and movements and such. But we have to define what low back pain is. Dr. McGill talks about, you can't say low back pain. Just like me saying, what's lower leg pain? Well, it could be my tib and my fib. It might be a nerve. It might be, I don't know, a blood vessel. It might be my gastroc. It might be my soleus. Or it might be coming from my back, from a lumbar nerve root into my lower leg. So again, we have to define what low back pain is. If you don't have low back pain, or if you don't have pain often, and we have to define what that pain is, but generally speaking, sometimes some soreness in the back after a squat and a deadlift, that'll come on for a bit. Someone might be sore and tight in the back, and it goes away after a day or two. That's probably acceptable. I have a lot of clients that are rebuilding the squat, the deadlift, the bench, these different exercises, and we use specialized exercises when we're rebuilding them to get them back to doing those lifts again, if they're lucky enough to be able to do them, because flat out some people can't get back to doing those things they love when they're back injured, and that's another video that you can check out soon. Unfortunately, some people just can't get out of pain. Looking for the answer to your sleepless nights, sore muscles, and better overall well-being? If so, PowerX Strength CBD has you covered. All of our products are made of CBD isolate and have 0% THC, meaning there are no worries of failing a drug test or the worry of feeling high. With PowerX Strength CBD, we offer a wide range of products and payment options to ensure you have the option that best fits your needs. Don't just take it from me. All of our reviews and client testimonials on our site speak for themselves. You can even get 20% off your order by using code YT1306 at checkout. Go to powerxstrengthcbd.com to order now so you can get back to sleeping, recovering, lifting, feeling, and being better. With that said, we have to define what back pain is, what level, what tissues are affected. And the person that just has a little bit of pain here or there, or is a little tight or a little sore, and they're good after a day or two, that's probably acceptable. I have a lot of people that are rebuilding with the lifts once again after they've built pain-free capacity in stage 1. They've fleshed out and built out that stage 2 specialized exercise pain-free capacity, and then they keep phase 1 and 2 in their program, and then go to phase 3 where it may be a deadlift of some sort, a squat of some sort, a throw, swinging the golf club, the tennis racket, whatever it may be. The key is slowly getting back to doing that thing once again, and the dosage matters. The intensity matters. It's not just the movement, it's the dosage of the movement, the frequency of the movement, the intensity of the movement. And that applies to the squat, bench, and deadlift, or someone swinging a tennis racket, or fighting in the UFC, or doing jiu-jitsu again. Got to microdose the exposure once again, then get them back to it. Back to the topic at hand. Short-term back tightness for a powerlifter is probably pretty common, right? Same thing for a strongman. Same thing for a football player. Same thing for a hockey player. These are all people that I see often. We know strongmen, powerlifters, football players, Highland Games throwers, UFC fighters. All these people have common low back injuries, disc bulges in particular, annular tears, facet joint hypertrophy, effusions, different things for the facets that we have going on with the people that twist and such. With that said, there's a difference between tightness and discomfort and pain. A lot of the time, tightness and discomfort is the starting point of an injury. The cascade can look like this sometimes. It starts with a little bit of tightness and discomfort, then it goes to pain, and then the third part of that is actually tissue damage and injury on a macro level instead of a micro level where it's starting to have a little bit of pain. That's why it's important to back off. So, short-term tightness does not always mean an underlying condition. It doesn't mean you're going to cascade right into back pain. We have to do a history intake. Do you have a history of back pain? My back just gets tight a little bit. I have my routine that I do. I do a little bit of the big three. I do a little bit of thoracic mobility. Then I get under the bar and squat and I'm good. I get a little sore the next day and then I'm fine. But that's great if that works for you and you're not getting worse and worse. But a common theme that I see with people is they start off okay, and they get a little bit worse and a little bit better, then a lot worse, then a little bit better. Then finally they end up in the ER one day. They're flat on the ground. They're lying in the lobby of the ER, which is not cool. It's not cool to go to the ER because your back is completely spasmed. All they're going to be able to do for you is give you a CAT scan or an MR. They're going to give you some Ativan probably to calm you down, and they're going to give you a Medrol pack. That's not cool to go to the ER. So don't cascade and train through actual pain. What is defined as pain? I don't know. Everyone is a little bit different, but nerve pain is very, very clear. If you have pain that is burning and stinging and goes down your leg, it's probably not a good idea to train, especially if it goes down to your toes and you have radiating pain and it changes and migrates all the time. That's potentially going to cascade. Those that just have a little bit of back tightness and you can kind of buff it out a little bit here and there and you get your treatment, you have your routine, that's probably okay to train with. But again, it depends on where you are in training, your biological age, your lifting age, what lifts you have to do, what your lifting history is, what your injury history is. There's so many different things that we have to look at. And it's why we can't give generic blanket answers to yes, train through the pain, or no, don't ever train again. It's usually going to be somewhere in the middle. Sometimes it's soft tissue, but I can tell you most of the time, and I'm a big fan of soft tissue. If you haven't seen the video that I did about chiropractors, check out that video right here, why most chiropractors are frauds. If you haven't seen the video about my massage therapy, my thoughts on massage therapy, you can check out that video as well right here. We're going to have it linked. I love massages. I love soft tissue, but I can tell you, I can count on one hand. There's been about 3 people, 4 people, I can't even count, 2 people, 1 person, I don't know. Not very many people have come to me and said, Brian, my back hurts, and it only be an erector spinae or a QL or a psoas or something like that. Now, these can a lot of the time be a side effect of a discogenic injury or a compressed spine or something like that. The muscles will either be facilitated or turned off. It just depends on the nature of the injury. There's too many different things to be able to kind of guess and project towards you. But you'll know if it's nerve pain and just a tight back, you're probably going to be okay. But at the end of the day, if you don't have daily back pain and you just sometimes get a little soreness in your low back after squats and it doesn't radiate and it stays there centralized, get a little soft tissue working, it feels better, you're probably okay. But if it does radiate and it changes and moves, you should probably shut it down because it sounds like you have a nerve that's affected, a nerve that's affected in your lumbar spine or maybe your thoracic spine, and you should shut it down and get an assessment. But short-term tightness does not mean you have an underlying pathology, especially if you do a lot of hard shit out there, like what I did moving into my new location here and lifted 80 horse stall mats at 95 pounds a piece. I'm a little sore. I was a little sore in the back. I was a little sore in everything from head to toe, actually. So it's not always a concern. Low Low back pain should become a concern when it starts radiating, when it's unrelenting, when it doesn't let up after a couple days of delayed onset of muscular soreness, and it has a unique feeling to it. Most people that I know that have actually had a serious back injury knew exactly when it changed, when it became radicular and sharp and piercing, or put them in the ER. Don't be that guy. Use deloads. I talk about deloads all the time in 2020 Live. You can't go hard all the time. If in doubt, don't try to stretch it out. That's one of the worst things you can do for a sore back. If in doubt, leave it alone. Go for a walk. Check out Back Mechanic for positions of respite. Shut it down. Don't make a thing bigger than it needs to be. You can always live to train another day. Don't end up in the ER flat on your back or flat on your stomach. I've had too many people reach out to me with that same exact story during a squat or a deadlift session. Don't be that person. Thank you so much.
Hope you enjoyed today's video. Remember, like, subscribe, share, click the notifications because we drop videos twice a week. We also have a live stream every Friday where I answer your questions. Click below to see the latest video that we uploaded. Also, for our products, our CBD, our books that correspond with these videos, it's down in the description. For more information about all things Brian Carroll and Power Rack Strength, go to powerrackstrength.com. You can book a consult both virtually and in person with me. Enjoy your week, and thank you so much.